My name is Cindy. I'm a PAH patient and have been for nearly 20 years at this time. I've been on Remodulin and pills for the course of those 20 years. Being tethered to a pump can be very difficult and typically comes with such side effects that are just very difficult to deal with on a day-to-day basis. And so in order to kind of get away from that pain and be able to do something a little differently, be able to do something like swimming or have a little more freedom and not be tied to a pump, I was really interested in moving to the pill form. When my doctor and I spoke about moving to Orenitram, one of the first items that we discussed was based on the dosage of Remodulin that I was on, whether there was a dosage that I could be on for the Orenitram. And one of the deciding factors was Orenitram. It could have a dose that was high enough so that I wasn't having to drop down in dosage and potentially have condition worsen. We looked at, my heart functions, my heart caths, echoes. I've been stable for the last several years. I was also doing well enough via my heart caths, showing that I was doing better in order to support it. And he felt that I was able to make that transition without it being a problem for me or for my condition. When I met with my doctor, we had a great conversation. We sat in his office talking together about the options, how the medication switch would work. The questions that I had were mainly around side effects. The side effects that he told me that the medication would have, the main ones were headache and stomach upset. The first couple of days, the side effects were bad enough, the headache and the stomach cramping, that I questioned a little bit, did I make the right choice? But it quickly disappeared and got better and better each day, with the headache going away first and then the stomach cramping going away by the time the second week came along. When I started my transition, my doctor was very supportive. They called and checked on me each day, made sure I was doing well, made sure I was handling the side effects. As far as UT, I was able to get a lot of patient documentation that I was able to read and ensure that the things that I was feeling and experiencing were completely normal and expected for the medication. I'm feeling better. I'm able to go do the things that I've been prevented from doing for the last several years. I'm not dreading a site change. For a new patient starting with the medication, I would first suggest that they speak with their doctor, see if they are a candidate, to be prepared to not necessarily feel the best those first few days. It felt pretty rough, especially for the first 3 to 4 days. And then after that, I got to where I was feeling better much quicker. It made me feel like I had hope again.
Important safety information for Orenitram. Who should not take Orenitram? Do not take Orenitram if you have severe liver problems. What should I tell my healthcare provider before taking Orenitram? Tell your healthcare provider if you have liver problems or diverticulosis. If you are pregnant, breastfeeding, and/or plan to become pregnant or breastfeed. It is not known if Orenitram will harm your unborn baby or if Orenitram passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby during treatment with Orenitram. About all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Orenitram and other medicines may affect each other, causing side effects. Do not start any new medicine until you check with your healthcare provider. Especially tell your healthcare provider if you take another medicine that contains treprostinil, such as Remodulin or Tyvaso. How should I take Orenitram? Do not change your dose or suddenly stop taking Orenitram without first talking to your healthcare provider. Orenitram is usually taken 3 times a day, about every 8 hours, or 2 times a day, about every 12 hours. Your healthcare provider will tell you how often you should take Orenitram. If you have side effects, your healthcare provider may tell you to change your dose or when you take Orenitram. Take Orenitram with food. Swallow Orenitram tablets whole. Do not split, chew, crush, or break your Orenitram tablets. Do not take Orenitram tablets that are damaged or broken. If Orenitram tablets are not taken whole, they may release too much medicine at one time. This can lead to side effects. If you miss your dose of Orenitram, take the missed dose as soon as possible with food. If you miss 2 or more doses of Orenitram, call your healthcare provider to see if you need to change your dose. If you take too much Orenitram, call your healthcare provider or go to the nearest hospital emergency room right away. You may see the tablet shell in your stools, bowel movements. This is usually normal. The tablet shell is not digested. If you have diverticulosis, the tablet shell may get stuck in a blind pouch or diverticulum in your intestine. What are the possible side effects of Orenitram? Orenitram can cause serious side effects, including worsening of PAH symptoms. Stopping Orenitram suddenly may cause worsening of your PAH symptoms. Do not change your dose or suddenly stop taking Orenitram without first talking to your healthcare provider. The most common side effects of Orenitram include headache, diarrhea, nausea, vomiting, flushing, and pain in arms, legs, and jaw. These are not all of the possible side effects of Orenitram. Tell your healthcare provider if you have any side effect that bothers you or does not go away. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. What is Orenitram? Orenitram is a prescription medicine used to treat pulmonary arterial hypertension, PAH, which is high blood pressure in the arteries of your lungs. Orenitram can help slow down the progression of your disease and improve your ability to exercise. It is not known if Orenitram is safe and effective in children. The risk information provided here is not comprehensive. To learn more about Orenitram, talk with your healthcare provider. Please see full prescribing information and patient information at www.orenitram.com or call customer service at 1-877-UNITHER, 1-877-864-8437.
Remodulin treprostinil injection. What is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with New York Heart Association functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure, symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilatation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-844-UNITHER, 1-844-864-8437.